What is cancer? Our bodies are made up of trillions of cells, each with a specific role to play. Normally, cells grow and divide in an orderly manner, replacing old or damaged cells. However, cancer occurs when this process begins to malfunction. In cancer, cells start to grow uncontrollably and don't stop when they should. These abnormal cells can form a mass called a tumor. Not all tumors are cancerous, but those that are can invade nearby tissues and cause serious problems. How does cancer spread? Cancer becomes particularly challenging when it spreads. Some cancer cells can break away from the original tumor and travel through the bloodstream or lymphatic system to other parts of the body. When these cells settle in a new area and form additional tumors, it's called metastasis. This is how cancer can affect multiple areas of the body. Types of cancer. There are over 100 types of cancer. Each type is classified by where it begins. For example, lung cancer starts in the lungs. Skin cancer develops in the skin. Breast cancer originates in breast tissue. Each type is unique, requiring tailored approaches to diagnosis and treatment. What causes cancer? It's often the result of a combination of factors. Genetics. Some people inherit a predisposition to certain types of cancer. Lifestyle choices, smoking, poor diet, and lack of physical activity can increase the risk. Environmental factors. Exposure to harmful chemicals or excessive sunlight can damage cells. It's important to remember that while some risks are beyond our control, adopting healthy habits can reduce the likelihood of developing cancer. Can cancer be treated? Advances in medicine have made significant strides in cancer treatment. Here are some common approaches. Surgery, removing tumors when possible. Radiation therapy. This uses high-energy rays to target cancer cells. Chemotherapy, medications that destroy or slow the growth of cancer cells. Immunotherapy, boosting the immune system's ability to fight cancer. It's important to note that early detection greatly improves the chances of successful treatment, which is why regular checkups are so important. Living with cancer. For those diagnosed with cancer, it is not the end of the journey. Many individuals live fulfilling lives during and after treatment. Support from loved ones, healthcare teams, and the wider community plays a vital role in navigating the challenges of living with cancer. Remember, understanding cancer is the first step toward its prevention and early detection. By making informed choices and raising awareness, we can all contribute to a healthier future. We hope you found the information in this video useful.
Signs and symptoms of cancer. It's important to be aware of any new or worrying symptoms of cancer, as spotting cancer in its early stages means it's easier to treat. If a doctor suspects cancer, they'll refer you to a specialist, usually within a few days to 2 weeks. Here are a list of signs and symptoms that could indicate cancer. 1. Changes in bowel habits. Speak to your doctor if you've noticed these changes and it's lasted for up to 3 weeks or more. Stomach discomfort, blood in your stools, diarrhea or constipation for no obvious reason, a feeling of not having fully emptied your bowels after going to the toilet, pain in your stomach or back passage, your stool is loose, pale, or looks greasy. 2. Bloating. If you've had bloating for 3 weeks or more, then speak to your doctor. 3. Bleeding. You should also speak to your doctor if you have any unexplained bleeding, such as blood in your urine, vaginal bleeding between periods, vaginal bleeding a year or more after the menopause, also known as postmenopausal bleeding, bleeding from your bottom, blood when you cough, blood in your vomit. 4. Coughing, chest pain, and breathlessness. If you've had a cough for 3 weeks or more, then contact your doctor. Symptoms such as shortness of breath or chest pain may also be a sign of a condition such as pneumonia. 5. Lumps. If you notice a lump in your breast, or if you have a lump that's noticeably increasing in size elsewhere on your body, then you must contact your doctor. It's important to regularly check your breasts, underarms, groin and testicles for any new lumps or changes. 6. Moles. Speak to your doctor if you have a mole that changes shape or looks uneven, changes colour, gets darker or has more than 2 colours, starts itching, crusting, flaking or bleeding, gets larger or more raised from the skin. Any of the above mentioned means there is a chance you have malignant melanoma, which is a form of skin cancer. 7. Unexplained weight loss. You should also speak to your doctor if you've lost a lot of weight over the last couple of months that cannot be explained by changes to your diet, exercise, or stress. 8. Tummy or back pain. If you have pain anywhere in your tummy or back and you're not sure what's causing it, then speak to your doctor about it. This includes a dull pain that's always there or a sharp pain that comes and goes. 9. Indigestion and heartburn. Some cancers can give you indigestion, or heartburn and acid reflux. This can feel like burning in your chest or make you burp or hiccup more than usual. Speak to your doctor if you get any of these symptoms regularly and are not sure why you're getting them. 10. Itchy or yellow skin. If your skin is itchy and turns yellow, or the whites of your eyes turn yellow, also known as jaundice, you should speak with your doctor. 11. Feeling tired and unwell. With some cancers, the symptoms can be harder to notice. It's important to speak to your doctor if you think something is not right or you keep feeling tired and unwell and you're not sure why. It's important to note that people have a higher risk of getting cancer if they have been diagnosed with another condition, which means they could be at a higher risk of getting cancer also. 2 or more of their close relatives, such as a parent or a brother or a sister, have had cancer. Remember, early detection can help treat cancers better and effectively, so seek advice from your doctor if you feel the need to. We hope you found the information in this video useful. Ovarian cancer. Signs to look out for. Ovarian cancer develops when the cells of the ovaries form tumours that become malignant. It is often referred to as the silent killer as it shows little or no symptoms, which are quite difficult to detect with screening. While it is most common in postmenopausal women, it has recently started affecting younger women in their 30s and 40s. According to recent research, early cancer detection notably increases the chances of survival, so regular checkups are important. Currently, there isn't any reliable test for ovarian cancer. The CA-125 blood test can give false negatives, especially in the early stages, while smear tests are not capable of picking up malignant cells. Furthermore, many of the symptoms of ovarian cancer are often mistaken for those associated with other diseases, such as irritable bowel syndrome. Here are 5 symptoms that may be signs of ovarian cancer. 1. Irregular bleeding. Menstrual irregularities could be a sign of cancer, so it is a good idea to monitor any persistent irregularities in your cycle and seek advice from your doctor. 2. Persistent bloating. Consistent bloating that goes on for more than 3 weeks could also be an indicator for ovarian cancer. Seek advice from your doctor as soon as possible. 3. Lower abdominal and pelvic pain. Although menstrual cramps and pain during menstruation are normal, persistent pain that lasts for more than 3 weeks could be a sign of ovarian cancer. Premenopausal women should be careful as these symptoms are often easily passed off for period pain. 4. Difficulty eating and feeling full quickly. A decrease in appetite that comes out of the blue and goes on for more than 3 weeks can be a sign of various ailments, among which stomach, intestine and bowel issues are the most common. However, it could also be a sign of cancer as well, so make sure you consult your doctor. 5. Increased need to urinate. If you find yourself visiting the toilet much more often than previously without any changes regarding your liquid intake, then this could be a sign of early stages of ovarian cancer. Another sign is an urgent need to urinate and the inability to hold it in. In conclusion, Most of these symptoms can be easily mistaken for problems and diseases with the gastrointestinal tract. Therefore, if you experience any of them and you haven't earlier, it is crucial to monitor their persistence and frequency and seek professional medical advice from your doctor if they do not subside in a few weeks. Remember that monitoring our health and learning to recognize the symptoms is the key to early detection and an increased chance of survival. We hope you found the information in this video useful.
Have you ever wondered how doctors diagnose serious conditions like cancer or liver disease? The answer often lies in a single, tiny sample of tissue known as a biopsy. In this video, we'll break down exactly what a biopsy is, how it's done, and why it's one of the most critical tools in modern medicine. From needle biopsies to surgical procedures, understanding this process could give you the clarity you need when facing a major health decision. Stay tuned to learn how this small test can make a big difference. A biopsy is a medical procedure in which a small sample of tissue is removed from the body for examination. The primary purpose of a biopsy is to diagnose diseases, particularly cancer, by analyzing the tissue sample under a microscope. The procedure helps doctors determine the presence, cause, and extent of a disease. It can be used to investigate abnormalities, which can be functional, such as kidney or liver problems, or structural, such as swelling in a particular organ. When the tissue sample is examined under the microscope, abnormal cells may be identified, which can help to diagnose a specific condition. If a condition has already been diagnosed, a biopsy can also be used to assess its severity, such as the degree of inflammation, and grade, such as the aggressiveness of a cancer. This information can be very useful when deciding on the most appropriate treatment. There are several types of biopsies, each suited for different situations and types of tissue. Needle biopsy. A needle is used to extract tissue or fluid. This category includes fine needle aspiration, which uses a thin needle, and core needle biopsy, which uses a slightly larger needle. Surgical biopsy. A surgeon removes a larger section of tissue. This can be an incisional biopsy, where a portion of the tissue is removed, or an excisional biopsy, where an entire lump or suspicious area is removed. Endoscopic biopsy. A flexible tube with a camera and tools, known as an endoscope, is used to view and collect tissue from inside the body. This can be from areas such as the gastrointestinal tract, bladder, or lungs. A punch biopsy. A sample of skin is removed using a scalpel, punch, or other instruments to diagnose skin conditions, including cancers and infections. Bone marrow biopsy. A sample of bone marrow, usually from the hip bone, is taken to diagnose blood-related conditions like leukemia or lymphoma. How a biopsy is carried out will depend on where the tissue sample is being taken from. Before the procedure takes place, a CT or MRI scan is often used as a guide to help in this decision-making process. Most biopsies will only require local anesthetic, which means you won't need to stay in hospital overnight. But an overnight stay is usually required when the procedure is carried out under general anesthetic. The majority of biopsies are painless once the anesthetic starts to work, although this depends on where the sample is being taken from. You may experience a dull ache, which can be treated with painkillers on the advice of your doctor or surgeon. Some types of biopsies may involve staying in hospital for a few hours. You may need to have stitches or a dressing applied before you leave. After the tissue sample is taken, it will be examined under a microscope to help identify the nature of the problem. This often means that a definite diagnosis can be made. We hope you found the information in this video useful.
The 12 different types of cancer treatments. Cancer treatment options have advanced significantly and can vary depending on the type, location, stage of cancer, and individual patient factors. Here are 12 types of cancer treatments available. 1. Surgery. This involves the physical removal of the tumor and in some cases surrounding tissues or lymph nodes to ensure all cancerous cells are removed. This option is most effective for localized cancers that haven't spread to other parts of the body. 2. Radiation therapy. This uses high-energy radiation to destroy or damage cancer cells. It can be delivered externally through external beam radiation or internally by brachytherapy. This option can be used alone or in combination with other treatments, especially in cancers like breast, prostate, head and neck. 3. Chemotherapy. This involves the use of drugs that kill rapidly dividing cells, including cancer cells. It can be administered orally or intravenously. Chemotherapy is often used for cancers that have spread, also known as metastasized, or as supplementary therapy after surgery to kill any remaining cancer cells. 4. Immunotherapy. This boosts the body's immune system to recognize and fight cancer cells. This includes treatments like checkpoint inhibitors, CAR T-cell therapy, and cancer vaccines. Immunotherapy is effective in treating certain types of cancers, such as melanoma, lung cancer, and some types of lymphoma. 5. Targeted therapy. This involves drugs designed to target specific genetic mutations or proteins that are found in certain cancers. Targeted therapy is used for cancers with specific molecular targets, like breast cancer or certain types of lung cancer. 6. Hormone therapy. This blocks or lowers the levels of hormones that fuel certain cancers, such as estrogen or testosterone. This is common in the treatment of breast and prostate cancers. 7. Stem cell transplant, also known as bone marrow transplant. This involves replacing damaged bone marrow with healthy stem cells. This can help in the production of healthy blood cells after intensive chemotherapy or radiation. This is commonly used in blood cancers like leukemia, lymphoma, and multiple myeloma. 8. Precision medicine. This often involves using targeted therapies and can include genetic testing to guide treatment decisions, as the treatment is based on the genetic makeup of the cancer and the patient. This option is increasingly used in various types of cancer to provide more personalized treatment options. 9. Cryotherapy. This involves freezing and destroying cancerous tissues. It's often used for small tumors, particularly in prostate cancer, or at early stage skin cancers. This treatment is effective for localized cancers or tumors that are hard to remove surgically. 10. Hypothermia. This uses heat to damage or kill cancer cells and is often used in conjunction with other cancer treatments like radiation therapy. This is an experimental treatment for some cancer types but can be effective for certain localized treatments. 11. Photodynamic therapy, PDT. This uses light-sensitive drugs and a laser to kill cancer cells. The drug is activated by specific types of light after it accumulates in cancer cells. This option is effective for certain cancers, such as esophageal cancer and some lung cancers. 12. Palliative care. This is aimed at relieving symptoms and improving the quality of life rather than curing the disease. It includes pain management, nutritional support, and psychological care. This option is used at any stage of cancer, often in conjunction with other treatments, especially in advanced stages of cancer. It's important to note that each of these treatments can be used alone or in combination, depending on the cancer type, the stage, and overall health of the patient. Treatment plans can be personalized to achieve the best possible outcomes for each individual. Remember, always seek the advice of your doctor or healthcare provider with any questions you may have regarding a medical condition and its treatment. We hope you found the information in this video useful.
Chemotherapy is a powerful weapon in the fight against cancer, but it comes with its own set of challenges. From debilitating fatigue and nausea to unexpected emotional shifts and hair loss, the side effects can be overwhelming. Here are 17 common side effects of chemotherapy that every patient should know. Understanding these can help you and your loved ones prepare for the journey ahead. The severity and type of side effects can vary depending on the specific drugs used, the dosage, and the individual's overall health. Let's start. 1. Fatigue. A common and often overwhelming sense of tiredness that doesn't improve with rest, resulting from the body's efforts to repair the damage caused by chemotherapy, anemia, or other related factors. 2. Nausea and vomiting. Many patients experience nausea and vomiting, which can range from mild to severe. Chemotherapy drugs can irritate the stomach lining or affect the brain's nausea centers. 3. Hair loss. Hair on the scalp and sometimes other parts of the body can thin or fall out. This is because chemotherapy attacks rapidly growing cells, including those in hair follicles. 4. Mouth sores. Painful sores or ulcers can develop in the mouth. This can make eating and drinking difficult. 5. Appetite changes. Chemotherapy can lead to loss of appetite, taste changes, or dislikes to certain foods. Nausea, mouth sores, and changes in your taste buds can all contribute towards this. 6. Diarrhea or constipation. Digestive issues are common, with some patients experiencing diarrhea and others can experience constipation. This is because chemotherapy can affect the cells that line the digestive tract, which then leads to these symptoms. 7. Anemia. Chemotherapy can lead to a decrease in red blood cells that can cause symptoms like fatigue, dizziness, and shortness of breath. This is because chemotherapy can damage the bone marrow, where red blood cells are produced. 8. An increased risk of infections. Patients may become more susceptible to infections due to a weakened immune system, as chemotherapy can reduce the white blood cell count in the body, which are essential for fighting infections. 9. Bleeding and bruising. Patients might bruise easily or experience more frequent nosebleeds or gum bleeding due to a drop in their platelet count. Platelets are necessary for blood clotting, and chemotherapy can lead to their reduced numbers. 10. Cognitive changes, often referred to as chemo brain. Some patients report memory issues and difficulty in concentrating after chemotherapy treatment. The exact cause is unclear, but chemotherapy can affect the brain, leading to these cognitive symptoms. 11. Neuropathy. Certain chemotherapy drugs can damage nerves, causing symptoms like tingling, numbness, or pain in the hands and feet, known as peripheral neuropathy. 12. Skin and nail changes. Skin may become dry, itchy, or discolored, and nails might become brittle or discolored. 13. Fertility issues. Chemotherapy treatment can damage eggs in women or sperm in men, causing their reproductive organs to be affected. This can lead to temporary or even permanent infertility. 14. Emotional and psychological effects. The physical toll of chemotherapy, combined with the stress of cancer treatment, can contribute to mental health challenges. Patients may experience anxiety, depression, or mood swings. 15. Kidney and bladder problems. Some chemotherapy drugs can cause damage to the kidneys or bladder, leading to issues like difficulty urinating or even blood in the urine. This is because some chemotherapy drugs can irritate the urinary tract or affect kidney function. 16. Heart and lung issues. In rare cases, chemotherapy can cause damage to the heart or lungs, leading to symptoms like chest pain or shortness of breath. Certain chemotherapy drugs are known to have cardiotoxic or pulmonary toxic effects. 17. Secondary cancers. Though rare, some patients develop secondary cancers years after treatment. This is because some chemotherapy drugs can increase the risk of other cancers due to their effects on your DNA and cells. It's important to understand that these 17 side effects can often be managed with medication, lifestyle changes, and supportive care. The intensity and duration of side effects vary. Some may be temporary and resolve after treatment ends, while others may have long-term or even permanent effects. It's crucial for patients to discuss any side effects with their healthcare team to find the best ways to manage them. Remember, always seek the advice of your doctor or healthcare provider with any questions you may have regarding any medical condition. We hope you found the information in this video useful.
Long-term effects of chemotherapy can vary widely depending on the type of drugs used, the dosage, the duration of treatment, and individual patient factors. While many side effects of chemotherapy are temporary and resolve after treatment ends, some long-term effects can persist for months or years, and in some cases, they may be permanent. Here are some common long-term effects of chemotherapy. 1. Cardiovascular issues. Some chemotherapy drugs can cause long-term damage to the heart muscle, leading to conditions such as cardiomyopathy or congestive heart failure. Regular heart function tests, for example echocardiograms, may be necessary after treatment to monitor your heart health. 2. Peripheral neuropathy. This is when nerve damage has occurred as a result of chemotherapy. Symptoms of peripheral neuropathy are tingling, numbness, pain, or weakness in the hands and feet. This condition can persist long after chemotherapy ends and can affect daily activities, such as walking or handling objects. The effects could be permanent in some cases. 3. Cognitive changes, also known as chemo brain. This is when patients experience long-term cognitive impairments, such as memory problems, difficulty concentrating, or foggy thinking, often referred to as chemo brain. These symptoms can last for months or even years after treatment and may impact your work and daily life. 4. Fatigue. Persistent fatigue is one of the most common long-term effects of chemotherapy. Unlike normal tiredness, this fatigue can be debilitating and last for years. It is recommended to do regular exercise, have proper nutrition, and good sleep to try and manage the effects of this fatigue. 5. Bone health. Chemotherapy can lead to bone density loss, which increases the risk of osteoporosis and fractures, especially in women who experience early menopause due to treatment. It is recommended to have calcium and vitamin D supplements, and do weight-bearing exercises, to help maintain your bone health. 6. Infertility. Chemotherapy can cause permanent damage to reproductive organs, leading to infertility in both men and women. This risk is higher with certain types of chemotherapy and if the patient receiving the treatment is at a younger age. Fertility preservation strategies, such as sperm banking or egg freezing, should be discussed before starting chemotherapy treatment. 7. Secondary cancers. There is a small but increased risk of developing secondary cancers, such as leukemia or lymphoma, years after having chemotherapy. This is due to the DNA-damaging effects of some chemotherapy drugs. The risk varies depending on the type and dosage of chemotherapy drugs that were used for treatment. 8. Kidney and liver damage. Some chemotherapy drugs can cause long-term damage to the kidneys and liver, leading to chronic kidney disease or liver dysfunction. Regular blood tests may be required to monitor your kidney and liver function after treatment. 9. Lung damage. Certain chemotherapy drugs can cause long-term lung damage, leading to conditions such as pulmonary fibrosis, which causes scarring of the lung tissue and can reduce lung function. Long-term symptoms of lung damage are shortness of breath, a chronic cough, and a reduced ability to exercise. 10. Hearing loss. Some drugs can cause hearing loss or tinnitus, which is ringing in the ears. This could be permanent. As a result, this can affect communication and quality of life, especially in older patients. 11. Digestive issues. Chemotherapy can lead to long-term changes in your digestive system, including chronic diarrhea, constipation, or changes in appetite and your weight. Dietary adjustments and medications can help manage these symptoms. 12. Emotional and psychological effects. Depression, long-term anxiety, or post-traumatic stress disorder, PTSD, can develop after undergoing chemotherapy. The psychological toll of the cancer experience itself can also contribute to these issues. Counseling, support groups, and sometimes medication can help manage these long-term emotional effects. 13. Endocrine disorders. Chemotherapy can cause long-term effects on the endocrine system, leading to conditions such as hyperthyroidism, which is an underactive thyroid, or it can lead to diabetes. Regular blood tests may be needed to check your hormone levels and manage any imbalances. 14. Immune system suppression. The immune system can become weakened for months or even years after chemotherapy treatment, which can lead to an increased vulnerability to infections. Patients may need to take extra precautions to avoid infections and may require ongoing vaccinations or immune-boosting treatments. These long-term effects highlight the importance of ongoing follow-up care for cancer survivors. Regular health checkups, monitoring, and supportive care are essential to manage and reduce these long-term effects, helping survivors to maintain their quality of life after treatment. Remember, it's essential to consult your doctor or healthcare provider for any chemotherapy treatment you need, and any concerns or questions you might have about the treatment process. We hope you found the information in this video useful.